Hi, I'm Dr. Robert True. I want to welcome you to my talk tonight on anti-aging and specifically on facial rejuvenation. This is the second talk of a 5-part series on facial rejuvenation. Tonight, we'd like to talk about how you can make yourself look younger with facial rejuvenation. I'd like to talk about how you can make yourself younger through anti-aging concepts. Well, what is anti-aging? Anti-aging doesn't mean that we're going to prevent you from getting older. It's not to stop you from getting older, but what it means is that we want to prevent possible problems that happen, possible complications that occur as we get older. We want to instill wellness in a body to help you to stay fit. And let's face it, by doing that, we can look younger too. That's part of anti-aging. We all want to do that. That's exactly what most people want, is to stay healthy and stay more youthful looking. A lot of people say, oh yeah, anti-aging, I plan on living forever. So far, so good. But it's more than that, really. Anti-aging means concepts that we can use to decrease the degenerative processes that cause the appearance of older age. You know, as we grow older, our bodies do go through a wear and tear process we call the aging process. And as we do this, some degenerative processes can happen. Well, anti-aging concepts try to decrease those degenerative problems that happen so that you can maybe stay healthier, stay younger for longer. Degenerative processes happen on the outside, externally, and also on the inside. Those things that you see on the outside are your face, your skin, your body, distribution of the fat, your muscle tone, and your vitality, your performance. But things that you see on the inside happen too. Degenerative process can happen in the brain, and the heart, blood vessels, on your bones, your muscles, and the fat, and then basically what they end up is giving you a very poor quality of life. And we don't want that. We want you to have a good quality of life. We want you to have healthy bodies and a healthy life, to live healthier and longer. Well, we look at anti-aging kind of like a disease. What we do with the disease processes, when a person comes to us, we discuss your concerns. We try to evaluate the problem, see if there's something we can do about it, why you're having this problem, diagnose the condition, in other words, and then we formulate a plan. Formulate a plan to try to correct these problems, or at least slow them down, and implement the plan. Then there's a maintenance plan so that you keep staying healthy for as long as you can. What are your concerns? Are you concerns of some sort of facial problems? Are you concerns a body situation where you have too much fat in certain areas? Or you just are simply overweight? Is your concern a hormonal problem, or do you just want to have better health? Well, my goal is to enhance your natural beauty both on the inside and the outside. And I do this through several different mechanisms. This is, as I mentioned, the second in a 5-part series on anti-aging. This is on facial rejuvenation. I'm also doing series, I've done one on weight loss and how losing weight can help you improve your health. Doing one on cosmetic surgeries, primarily breast and body, to help you to look younger. And the next one is going to be on hormone vitality, and the next on nutritional age. But today we're talking about facial rejuvenation. So as an overview, I'd like to discuss certain aspects of aging so that we know how do we age, and maybe we can figure out a way to slow that down or prevent it. So there are things that we can do to help you to prevent the aging process. Things like Botox, facial fillers, phototherapy, laser therapy. We'll talk about the vampire lift. Then we're going to talk about maintenance and what you can do to help preserve that youthful look. So let's talk about the aspects of aging first. Well, as we all know, as we get older, things do happen. Wrinkles develop on our face. We get also some other things that make us look older are pigmentations that are on the face, abnormal pigmentations. And also you get a loss of volume, and we'll discuss that more. You get loss of texture and tone, and your skin sort of sags down. Well, there are a lot of reasons why these things happen. There are genetic factors. There are factors that are external factors, such as sun exposure. Smoking is a terrible thing that we all do to ourselves, but smoking has an effect on our skin, pollutions, and there are many external factors. Well, what happens as we get older is the outside surface of your skin, or the epidermis, tends to get thicker, while the underneath the epidermis, the area where the collagen is, that tends to get thinner. And these cause the look of being older. In addition, the pigmentary changes happen, like sunspots. We also call them age spots for a reason, because they tend to occur as we get older. And this, there's a loss of volume. With the loss of volume, you get a sagging of the skin. In this picture here, you can see this lady, she in a youthful look, and as she gets older. And you notice that right under the eye, she has quite a lot of sagging here, loss of volume. Well, what happens when you lose the volume here, it sort of sags down, and you get an increase in appearance of this crease called the nasolabial fold, from the nose to the lips, corners of the lips. That's a nasolabial fold. So you get a crease there, you get the sagging, and plus you get loss of volume in the lower area too. These are all signs of aging that maybe we might be able to help, and we can. In a man, similar things happen. Once again, you have the aging, especially right in the middle area here. Kind of makes him look kind of mad and angry. You get loss of the volume in this area here. We call it the tear trough formation, and the malar area. And notice he's got some pigmentations here, sunspots. Then, with this loss of volume, once again, you get the sagging of the skin and the appearance of being older. So what can we do about all these things? Well, let's start with wrinkles. What can we do to decrease wrinkles? If you notice on this lady, some of the more prominent wrinkles are on the forehead, up above here, and she has some at the crow's feet. She's got some in the nose area too. Well, we can decrease some of those wrinkles with the use of a neurotoxin called Botox. What this does, it relaxes some of the muscles in the face that cause these wrinkles. It only affects those wrinkles formed by the contraction of muscles in the face. And these include things like the forehead lines, they include the frown lines, those ones right in the middle, or we also call them anger lines. It includes the crow's feet on the sides too, and sometimes a little below the eye. And Botox is great for a lot of wrinkles, but it also helps out in other things. We can actually sculpture the face to make it look a little differently. We can do a little brow lift in women, we can make the smile turn up a little bit, or we can reduce some of the gum showing. And there are things that we can do on the neck too. Then if you have a little asymmetry on one side or the other, we can help to make it more symmetrical. Botox is a wonderful medicine that will help out to decrease those effects of aging of wrinkles. So let's talk about how Botox works. It's a neurotoxin that relaxes the muscles in the middle. Now, primarily those are muscles we call right in the middle, and just to the sides of the middle. We call those the frontalis and the corrugator muscles. We try to relax those, and it gives you a more passive look, a more calm look. In addition, we relax the frontalis muscle. The frontalis muscle is the muscle up here, kind of goes up and down, and it creates, when you lift up, it creates those wrinkles up here. And we can relax those so that you don't have as many wrinkles, you have a more smooth forehead. Now, we don't want to give so much that you can't have expression. You still want to have expression, but we can relax them so that it's more smooth. So let's see some examples. The forehead and glabellar area, you can see that they're more smooth, relaxed. The muscles, the appearance of the person looks better also. When we have these muscles contracted, a lot of times it kind of makes you look angry. And a lot of people might look at you and say, boy, you look angry today. But really, you're probably not angry. You just have these muscles contractions. So sometimes it gives the wrong impression to people regarding how we really do feel. And we may be very passive. Well, with Botox, it gives you a more serene look and serene quality to the face. Makes you look happier and not mad, more calm. And it works for not only women, but it works for men too. Men can also have that kind of an angry look to their face. And with Botox, we can relax that a little bit and make it look more passive or calm or serene. Let's talk about the crow's feet a little bit now. Crow's feet are caused by a contraction of the muscles around the eye, specifically on the sides of the eye. We call these orbicularis oculi muscles. And if you relax the muscles on the side, it tends to relax the wrinkles, or what we call relaxation of the crow's feet. Next, I'd like to talk about sculpting the face with Botox. And one of the things that a lot of women like is a little brow lift. What we do is we put a little Botox in the orbicularis muscle, just on the lateral side of it. That's the part that makes the brow come down. By doing that, we allow the frontalis muscle up above to pull the brow up a little bit. So you just get a small little lift of the brow. And you can see in this lady, she has just a very small increased lift. So the arch, the lateral arch, goes up just ever so slightly in women and makes it nice and pretty for women. Now in men, the opposite, we don't want to have that. Another thing we can do is lift the corner of the mouth up. We can give a woman sort of that Zeta Jones look, that Zeta Jones smile look, because as we get older, the smile lines tend to come down. We have excessive contraction of the depressor muscle here. If we just relax this depressor muscle and allow the levator muscles, the ones that make the smile go up, to overcome, we get a turnaround of the smile and sort of that Zeta Jones smile look. And it looks very nice and very pleasant, as in this case right here. Another thing that we can do is to decrease the excessive gum line when certain people smile. What we do is we put a little Botox in the muscle that lifts that lip up, and that relaxes the lip so that it doesn't pull up quite as much, so you don't see as much gum line showing. It works very nicely for those people who have this kind of a problem. Another type of a problem that a lot of people have is something called the peach pit chin, where when they smile, they have this pitted appearance of their chin, and it looks like a peach pit. That muscle is called the mentalis muscle. And we can relax this muscle by just putting Botox in there to decrease that, smooth out that peach pit appearance. Another area where we can sculpt is in the platysmal area, the neck area. The platysma muscle is a muscle along the neck here, and as we get older, we have bands that form of the platysma muscle, and they sort of prolapse down. Well, we can relax those bands with some Botox to really decrease the platysmal bands, and they kind of make people look older. Without them, they look younger. Well, let's talk about the face of youth, because it's very important. If we want to look younger, we got to find out, well, what does it look like when you look younger? And here's an example of a child, and you can see the child has a lot of vitality to the skin. It's sort of a pinkish. He's got a very bright look to his skin. And in addition, he's got a full face. So a young, youthful looking face is bright, and it is full. And it has a youthful, bright glow or vitality to it. That's what we try to emulate. But this is not something new. The Renaissance painters back in the 16th, 17th century knew about all this stuff. You can see in this painting, youthful appearance is bright, and it has vitality. It's got a little pink color in it, and it's very full, as opposed to the older, aged face on the side here, where the man looks older. He doesn't have that volume that he had, that the youthful people have. He's got some sunkenness, some loss of volume, all the things that we sort of talked about earlier that cause the appearance of getting older. So let's talk about this loss of volume a little bit more. Most people, they lose the volume right underneath the eyes, and they're called the tear trough formation. And when they get a sunkenness of the eyes, and plus they lose some volume around the mouth, from the nasal, labial fold area, and the lower chin area. Basically what we're doing is we're trying to put back what time and nature has taken away. They have taken away the the fat in these areas here. Notice in this lady, once again, she's got lots of volume here underneath her eyes, which allows the sagging to occur, and the sagging causes a deepening of the crease here, the nasolabial fold, and decrease in volume here. So it's obvious what we need to do maybe is to fill this thing up, and that's exactly what we do. We correct that volume loss with facial fillers. One of the ones that I like to use is Juvederm. It is a hyaluronic acid filler, but there are some other ones such as calcium fillers with Radius. There's some polymethyl methacrylate fillers like Artifill, and then we can also fill up the area with your own fat, and we'll talk about that a little bit more. But let's talk a little bit more about Juvederm, because that's the one I kind of like to use. Well, it is a preparation made from hyaluronic acid, which is a natural substance of the skin. It helps to restore the volume and the restoration. Once we put the Juvederm in, that restoration lasts for a good 9 to 12 months. You've got a nice increase in volume. It'll help fill those creases, especially in the nasolabial folds and in the submalar areas and the tear trough areas. And it really helps to give you a more youthful appearance. You can even do it in many different areas, and it is sometimes called the new liquid facelift. Here's an example of somebody with some Juvederm right in the tear trough areas, some in the nasolabial fold areas. When you fill them up, it gives you a more youthful look. A more youthful look. And now you can use Juvederm to sculpture the face too. One of the ways I like to do that is to put Juvederm in the lips and give it a little lining of the lips, make them look nice and pretty. You don't have to have huge lips. I know a lot of people, they put Juvederm in and they put just way too much in, and people get these duck lip formations, which I don't think are very pleasant, but what you need to do is sculpture it in an appropriate fashion just so that you accentuate it. I like to do the lips sort of like women like to do a liner of their lips, and so that we just line the lips and accentuate that little line. We call that the vermilion border. We can put fat in the tear trough and the malar areas to restore volume. What we do is we just suction a little bit of your fat, and we prepare it in a special way, and we re-inject it in there. Some people call that fat rebalancing, because you're putting back the fat that age and time has taken away. You need to rebalance that fat so you look younger again. And there's no question, when you put your own fat inside, you get a rejuvenation, because it's your fat, it's your own tissue, and it looks more natural, and you do have a more vibrant, rosy look to it. And I think people look younger when they use their own fat and more vivacious. And then you can do a combination of things. You can do Botox, you can do fillers, like this lady had Botox up above and fillers in her tear trough areas, as well as this lady's. You can do lots of combinations. A lot of people, they'll do fillers, Botox, and also other things on the skin like chemical peels, where you have a resurfacing of the skin. But here's one of the newest things that I think is really quite amazing to improve the volume, and that is called the vampire lift. It's using your own blood to help you restore your volume. Why the vampire? Why the name vampire? Well, we use your own blood, and vampires suck your blood, but also vampires are depicted as young, very beautiful or handsome people, and they seem to live forever. Thus, the idea of the vampire lift is very provocative. Therefore, we use your own blood to help preserve your facial youthfulness. So what we do, we draw some blood, put it in special containers, and spin it down in a centrifuge, and we isolate part of the blood that has the platelets. It's called the platelet-rich plasma portion of the blood, and that's got the growth factors in it, and we'll discuss that more. We re-inject that particular part of the plasma into your face and in the areas that we want to fill and rejuvenate, and it does act as a filler, but it really more than anything else is a stimulant to the growth of your tissue and your vessels. We put filler in there in addition to using the PRP, because we want to add some volume to that. So I usually put some hyaluronic acid, which is a natural, very natural substance, and it gives you a nice volume. Put the hyaluronic acid in there, and with the PRP in there, it stimulates the growth of your own tissue there. So the result is your skin gets a more full look, and it looks like more of a glow. It has a glow to it. There's a lot of growth factors in PRP. There's growth factors to stimulate growth of tissue, fibroblasts, growth factors to stimulate the vessel growth. So if you have more small little vessels in there, it can stimulate the growth and bring in nutrients to that area, so that you get not only a better volume and more of your tissue grown in there, but also with the more blood, you've got that more of a youthful glow. Very important. And it helps not only the tissues of the cells, but it also helps the fibroblasts grow, so you got more structure in there. It works great with fat, but it also works very well with the hyaluronic acid fillers like Juvederm. The vampire lift basically increases your cells. It's used in combination with the fat or the fillers to improve graft survival, to improve the vascularization, to improve the blood supply there, and to increase the total cell number and cell count and the fibroblasts in that area. And the reality, you kind of get less problems with lumps or bumps because you're rejuvenating more of the fat can survive. Here's an example of the vampire lift where we fill up the tear trough formation right below the eyes, rejuvenating the skin. It looks more vivacious. She's got a more glow. The nice thing about the PRP is that it is your own natural substance. So you're not going to get a foreign body reaction to it because it's your own stuff. And one thing we must realize, that the vampire lift is not a surgical procedure. The vampire is not a real true facelift. The lift that you get is because of the lifting up from the increase in the volume on the skin to give you that more full look of youth. That's the reason why we do this, is to give you a more full look, but you get that beautiful glow from the vampire lift. If you would like to have further information on these topics, my website is truemd.com, or you can call the office at 817-399-8783, and we can discuss these further. You can come in, have an appointment, and we can see what kind of concerns you have and how we can help you. Thank you very much again.